Well, I'm now joined by Alexandra Saieh, who's the head of Humanitarian Policy and Advocacy at the Save the Children charity from Miami. Thank you very much for joining us on the News Hour. So, stark warnings from the UN now over the widespread threat of starvation. What is your organisation reporting back on the level of suffering now that's being endured?
Thank you for having me. I mean, there seems to be no limit to the inhumanity that people in Gaza are being subjected to. Not only are we hearing that bombardment continued in the middle areas, these are areas that people fled to from Rafah because they were told to flee, but we also know that across Gaza, the amount of aid that has entered the Strip over the last month is some of the lowest levels that we've seen over the last several months. There's still no guarantee of safety for aid workers. We're still not getting the levels of aid needed. And we fear that now there is going to be an acceleration in the number of people that die from starvation, disease, dehydration, malnutrition, and also denied medical assistance. There are numerous reports of children with chronic illnesses like cancer, diseases, also common illnesses that are just getting worse, who are not able to get the medical attention that they need because so many hospitals across the Gaza Strip are either having been issued evacuation orders by the Israeli forces or are running out of supplies. And so the situation across Gaza is just absolutely catastrophic. And we really don't see anything changing unless there is a ceasefire and the bombardment stops and we are able to actually get the amount of aid needed and also distribute it safely to the places and the people that need it most.
The level of demand for services from organisations like yours must be now simply overwhelming. What can you do in terms of practical terms, in terms of helping people on the ground?
Exactly. The level of needs today are much higher than they were 7 months ago, and that's part of the problem. We're seeing lower levels of aid entering and then higher needs. Save the Children is on the ground delivering or trying to deliver pediatric services to children who have suffered injuries from explosive weapons. We're also supporting healthcare workers in addressing cases of malnutrition. We're also setting up, where possible, child-friendly spaces where children can be children again and learn. But again, because there is no place in Gaza that is safe, and because the situation is so overwhelming, the amount that we can do is very little compared to the needs. And again, there is no guarantee of safety for aid workers and places where people have sought refuge. Displacement camps continue to come under attack. Shelters continue to come under attack. Hospitals have come under attack. And so where are people supposed to go? And so we're trying our best, along with our peer organizations and local organizations on the ground, to do what we can. But until there's a ceasefire, what we can is not enough.
Would you say that prediction by the UN chief is realistic, or could it perhaps be underestimated?
Look, we don't even, because of the lack of access and because the hospital systems are so overwhelmed, we don't have the full picture of how bad the situation is. For example, the number of people who have been recorded to have died of malnutrition, these are people who managed to reach medical points and have had their deaths recorded. There are numerous other people who we believe may be suffering from acute malnutrition and also deaths who are just not being recorded. And so the numbers that we're seeing are likely the tip of the iceberg.
OK, Alexandra Saieh from Save the Children, thank you very much for your insight and your time this evening.